Okay, so today also I'll be continuing with the levels of prevention. So I will share my slides. Okay, I hope it's visible. So I think everyone is already okay. Everyone is familiar with the four levels, okay, in which we have the pre-model levels of prevention, the primary, secondary, and the tertiary. Okay, so last in the last class also briefly we have discussed what do you mean by prevention. Okay, so where in prevention it includes all those action, all those activities which we do in order to prevent the occurrence of a disease, or even if a disease it might occur, how it to reduce its consequences, and if the disease is already in the late stage, how we are trying to reduce or improve the health of the individual, okay, by helping him how to live with his disability, by providing different forms of rehabilitation. So all these actually comes under the words prevention. Okay, so this also okay. So I'll directly starts with the levels. So I think in last class also I think briefly I have discussed about pre-module. Okay, in which whenever we talk about pre-module prevention. Okay, so what is pre-module? It includes all those activities, all those actions that you are doing before the occurrence of any risk factors. Okay, so like I have also given the example now, like how has been seen that these young children. Okay, so young children, okay, if they are not maintaining their diet, when okay, from the time when they are in the childhood period, if they don't maintain their diet, if they're continuing eating junk food, if they're maintaining unhealthy lifestyle, so what happened to these children later in their adult life? They might develop different forms of disease, okay, because of obesity. They might develop hypertension, they might develop diabetes, they might develop cardiovascular disease. So likewise, what happens? So in this premortal prevention, so what we are trying to do, we are trying to improve the health, the lifestyle factors, because everything, actually everything, our health, everything, it mostly is related to our lifestyle. Okay, so by making the health children, okay, we by letting them have a very good lifestyle even from their childhood time. So we are trying to prevent the development of all these risk factors. Okay, because obesity is a risk factors for so many disease. It is a risk factors for diabetes, it is a risk factors for hypertension, for the various form of heart disease. So like this, as it is seen, so we are trying to do the actions during the childhood period only, because in because if you don't do it in the childhood period, it is very difficult to make some lifestyle changes when it reach adulthood. Okay, so everything should start from there when they were young. Okay, so if you're making them do, okay, follow a very good lifestyle eating habit from their younger age, then it will be easy for the individual also to carry on that same lifestyle habits in the later life. Okay, so that is the meaning of the word primordial prevention. So this is how we try to remove the occurrence of any risk factors. So another example is like, for example, it has been seen that, okay, young boys and all, they are very prone, okay, because of peer pressure. Okay, so all this thing, it then they might be prone, they might be addicted to smoking or any form of substance abuse. So before all those things happens, what will happen? Like we will try, okay, in their childhood area, okay, in their childhood or adolescent time, we will try to educate them about what is the health hazards of taking, okay, substance or in the form of alcohol, or what is the health hazards of smoking. So like that, if they know that, at least they'll be aware. Okay, so maybe because of that, if we counsel them, so it will prevent them from having any risk factors. Okay, because smoking, it is associated with so many disease like lung disease, okay, lung cancer. So even I think everywhere also, whenever we go anywhere, every time they are giving the, okay, what are the this hoarding related to, okay, what is the main causes of lung cancer, how smoking really, okay. So all this actually we are trying to do in the primordial prevention. And in the primordial prevention, actually, what is the main things which you really, which the, as a nurse, what we should really do is the health promotion and health education. Okay, so the main things or the interventions which we should initiate during the premortal prevention is your health education. So health education is a very important factor. Through the help of health education, we will try to make the people aware, okay, what are the risk factors that they may develop, okay, because of eating habit, because of lifestyle. So this is actually one wording which says, okay, So as you can see here, so the genes actually loads the gun, okay? Then the lifestyle, it pulls the trigger. So now you can see here, by looking at this only, you'll be able to understand like how lifestyle really affects our health, okay? We might naturally, we might be born with, okay, we might be, okay, luckily we might inherited very good genes from our parents. But what happens if we don't maintain our lifestyle, if we don't eat healthy food, if we try to drink, if we smoke, if we eat junk food, all those, then what happen ultimately? How much? Okay, so all this, it really affects our health. It really leads to, it may make us a risk at risk so so many disease. So that is the main meaning of this one. Okay, this what, okay, this verb code which says the genes loads the gun and the lifestyle pulls the trigger. So everything depends on the lifestyle. Okay, so if that's why lifestyle is a very important factors. So whenever we try to give health education, we are always focusing on the lifestyle modification, okay, where we try to make them understand how to eat healthy, how to maintain their sleeping hours, sleeping pattern, improve their healthy habit, cleanliness. So many things comes under lifestyle. So the main intervention actually here in the pre-model, we are focusing on the mass health education because our main concern is for the general population, okay? And we want everyone, because we are not considering any individual who are at risk. We are taking all the individual at having a very chance of developing that disease. So whenever we go for intervention also, we are focusing on the mass, not like suppose in a primary intervention. In primary prevention, we are going to focus only on those individuals who are having the risk, okay? But here the individual, nobody is having the risk, but there is chance that if they are not maintaining their lifestyle or their this thing, okay, they might have the risk. So that's why in pre-model we are focusing on the entire population or the mass, okay? So examples here, what are the initiative which is done by the governments is like we have so many national programs. So these national programs, actually you'll be learning more in details when you reach your fourth year. Okay, we have so many programs in our country which really helps in controlling various forms of communicable or non-communicable disease. Okay, so the help of these programs only, they have so many health camps, they try to give health education, they try to do the treatment. All this is done during these national programs. So few example of national programs is like, suppose everyone I think is aware of the National AIDS Control Program. Okay, that is also one program which is focusing on prevention and control of AIDS. Okay, and then another thing is like food and nutrition program is also there. Okay, so we have the prevention of food adulteration. Okay, so this food adulteration, so this also actually why we do that, because adulteration, it means like adding some extra, okay, unhealthy substances to the food. Okay, so which might be harmful for the individual. So this is how they are trying to improve the health of the mass population. Then comprehensive policies for discouraging smoking. That's why everywhere if you go, you always see no smoking zone or smoking is injurious to health. All those, it is being given everywhere just to make the people aware. Okay, how much really smoking really, how it really affects the health of the individual. And not only that, if you remember, if you go to any cinema or anywhere, even before starting up any movies and all, they used to give some advertisement of how if a poor person smoke, how it affects their lungs. So all those, actually these are some of the initiatives which is done to make the people aware about what are the uh, ill effect of drinking or of smoking, of having alcohol, or even any form of drugs abuse. Okay, anything which is not healthy for the individual's health. Okay, so this is about the primordial prevention. Are you clear with this? Yes.
Yes, ma'am.
Okay, so remember primordial, we are focusing on the mass population. Then next we'll see with the primary. Okay, so primary means we are going to focus on those individuals who have the risk factors. So whenever we say that, suppose already in the family, already the mother is having hypertension. So by that only we'll be able to know, okay, so since the mother is hypertensive, so there's high chance that her children also, they might be hypertensive in the later years, because hypertension, diabetes, these are hereditary disease, okay, even cancer, okay. So what they can do here, we will try to focus on those individuals who are having the risk. So we will try to give them, make them aware, okay, make them go for screening, okay. We will try to give them health education because already they are at risk. So doesn't mean that just because you are having the risk, you will have the disease. It's not always like that, okay. Just because my mother is hypertensive, I will I will also have hypertension. That also it depends. Like 50% chance might be there, but if you maintain your health, if you maintain your diet, okay, if you're doing exercises, then you might not develop the disease. Okay. But the thing is that but you are having that risk. Like 50% risk is already there because of your genes. Okay. So actually here, whenever we see the definition of primary prevention, it says it can be defined as the action taken prior to the onset of the disease, okay, and which remove the possibility that the disease will occur. So we are focusing mainly on the high risk group, okay. So the main interventions here also we are doing how what we are doing, okay. Whenever we say intervention, that means some activities or some of the actions that we are doing, okay, in order to prevent the individual from having any form of disease. The first is the health promotion. Okay. So health promotion is in a way like we are trying to involve the people. We are trying to educate them how to improve their health, how to maintain their health. Okay. How to develop a positive aspects towards their health. Okay. How to have a healthy lifestyle. All those comes under the health promotion. So whenever we say specific protection means we are trying to make them protect the individuals from specific disease. Okay, for example, it's protection against malaria. Okay, we'll tell them what are the, if they are living in an area which is very dirty, where the lane is very dirty and there are mosquitoes, so many mosquitoes breeding there. So we are trying to tell them how to protect themselves from malaria. So we will, because they are already having the risk. So we will give them education about how to use mosquito net, how to use mosquito repellent cream, okay, how to wear long sleeves, okay, all those clean their air, keep the surrounding clean. So all those comes under specific protection, okay. So specific protection, it is like a direction or activities which we are directed only toward a specific disease, okay. So it can be any form of disease which is very common in that particular population, and this also differs from community to community. Like for example, here we might have more cases of malaria, but in other cases, in other places we might have more cases of other disease, so like that, okay. So whenever we say primary prevention, actually how we can achieve it by health promotion and specific protection. So what comes under health promotion activities? Okay, the first is health education. Okay, then next is environmental modification. So we are trying to modify the environment in which we are trying to keep the surrounding clean. We are trying to make, okay, so make sure that individuals are having adequate clean water for drinking. They should have adequate toilet. Okay, they should not do any form of open field defecation, because those also it has been seen that because of open field defecation, it really causes lots of transmission of many forms of waterborne disease, or not only that, some from the soils and anything, okay. Then next is nutritional intervention. So whenever we say nutritional intervention, that means we are trying to give some form of nutritional supplements, or if suppose if the family, if they are, most of them, they are having a history of having anemia, okay, less hemoglobin in the blood body. So what we can do is we can try to give them some form of health supplements in which we can give them some iron and folic acid, okay. Then we'll educate them about how to take a healthy diet which is rich in iron, green leafy vegetables, and even we can, even for the children, okay. So every children, if you see, actually we used to give them this vitamin A. Okay, why we give vitamin A is actually because it has been seen that vitamin A, lack of vitamin A, it is mostly related to blindness, okay. So in order to reduce all those, so they are providing them with vitamin A supplements. Then all those things come under the nutritional interventions. The next is lifestyle and behavior changes, okay. So these also we are trying to make them to adapt healthy lifestyle, eat healthy, okay, sleep at least 8 hours in a day, okay. then then for older adults, okay, okay, even minimum 6 hours is also enough, but for young adult and children, okay, they need at least 8 hours of sleep. They should drink clean water, eat healthy, okay. All those things comes under your lifestyle and behavior changes. And the next thing what comes under your specific protection is first is immunization, okay. So this also, that is the main reasons, because really immunization is a way of how we are trying to protect ourselves from that particular disease, okay. So in we actually in India we are following the national immunization schedule, okay. So this, so different forms of immunization is given, okay, like polio, then this hepatitis, your rubella, okay. Rubella, it is mostly closely associated with diarrhea. So all this, so many forms of immunization or vaccines, they are being initiated under the national immunization program, okay. So all this also I think you will be learning, okay. more in details later. So we have so many different immunization or vaccines which is given at specific period of time. Okay, usually for children under it's up to 16 years, and after that even for the pregnant woman we are giving this immunization. So this is also one form of specific protection, because each vaccine it is helps in protection against specific disease, like for example BCG. Okay, so BCG it is mostly given to prevent from tuberculosis. So that is the simple example of immunization. Okay, then chemoprophylaxis. Okay, so chemoprophylaxis also where in which we are trying to prevent, okay, giving treatment. For example, for patient with malaria, we try to give them some anti-malarial drugs. Or patient with cancer, we are trying to give them some, no, sorry, not cancer. Okay, so this like malaria, no, so those comes under your chemo prophylaxis, okay, which we are trying to give some form of drugs. Okay, so this comes under the chemo prophylaxis. Use of specific nutrients or supplements. So whenever we say specific, that means we are going to concentrate on a specific type of nutritional deficiencies. Okay, suppose an individual is having goiter. Okay, goiter it happens because of the lack of iodine, okay, in the diet. So the person might have enlarged neck, okay, or enlarged this thing. So what happens in those type of people with that type of symptoms, so we will give them iodine. Okay, so iodine supplement salt. Okay, because it has been seen that iodine it is really helps in the prevention of goiter. So that is the meaning of the word specific nutrients. So we are trying to focus by providing them a specific nutrients based on their nutritional disorders. Okay, that is meaning of specific nutrients. Or we can give them some form of supplementation, okay, to the individual. Then safety of drugs and foods also comes here. Control of environmental hazards, for example air pollution. Okay, because of air pollution also we have seen that so many health hazards it can cause. Okay, lung problems. Okay, so many things comes under this uh, environmental hazards. Actually, this is just one example. Noise pollution is also one hazard. Water pollution is also one hazard. So those are the things which comes under the these are on things which comes under the primary. Okay, so whenever you write primary prevention, you remember we have two aspects. We have the health promotion activities and the specific protection. Okay, so, and actually in this primary prevention, we have two main approaches. Okay, we have the mass strategy and the high risk strategy. Okay, so the mass strategy actually here, what we are taking is we are taking all the individuals who are in the population, okay, irrespective of the risk factors. And if you say risk means high risk, we are going to take only the high risk population. Okay, so this is the main approaches which comes under the primary. So are you clear with primary prevention?
Yes, ma'am.
Okay, so this is about the primary prevention. So next we'll move on. Okay, so this is actually just the explanation, same explanation which I have said. Okay, in population, we are trying to uh, take the entire population, in population or mass strategy. So here one example is given, like how studies have shown that even a small reduction in the average blood pressure or serum cholesterol of a population would produce a large reduction in the incidence of cardiovascular disease, because actually these things they are related to cardiovascular. Okay, so cardiovascular disease, that means disease related to your heart. Okay, like it can be your heart this one congenital heart disease or coronary heart disease. Okay, so coronary heart disease in which where there is a this one accumulation of some cholesterol, this one fats. Okay, because of that it causes disruption in the blood flow to the heart. Okay, which it cause in severe form of symptoms, like the person might have palpitation, or he might have breathing difficulty, he might have this one pallor. Okay, then so many things, or even heart attack. So this is the main strategies with this being shown here. So in population or mass strategy, just remember we are focusing on the entire population. Okay, then if we say high risk, that means we are going to include only those individuals who are already at risk. Okay, so it might be because of the environmental risks, or because of they are already having a family history of certain types of hereditary disease. Then comes to the secondary prevention. Okay, so whenever we say secondary prevention, it is actually those actions which prevent the progress of a disease at its early stage, and it prevents in complications. Okay, so already sometime, for example, that's why we always initiate others to go for early screening. Okay, as you have seen, like it is also been said that cancer, if it is at the early stages, it can be treated, right? So that is the main reason why they always used to say that whenever you feel like you're having any sign and symptoms of having cancer or anything, so you should go early for checkup. So at least if you are screening early, then you'll be able, at least the prognosis will be good. Okay. So it attempts to arrest the disease process, progress, restore health by seeking out unrecognized disease and treating it before any irreversible pathological changes. So whenever we say irreversible means some things which cannot be reversed back. Okay. So before that things occurs or before it proceeds further or becomes very complicated, okay, so we are trying to stop it, or we are trying to prevent it during that stage, and reverse communicability of the infectious disease. Okay, so this is actually there under the secondary prevention. That means here the disease might be there, but we are trying to arrest it, or we are trying to stop it so that it will not spread to the later stages. Okay, and prevent any forms of complication. So the main intervention which comes under your secondary prevention is your early diagnosis and treatment. Okay, so we are trying to diagnose the people early, and we are trying to treat them as fast as we can, okay, at the earliest. And we're also trying to give them some form of because it says early diagnose. If you are diagnosed as an early stage, then the progresses also will increase, or it will be better. Okay. So with this main initiative, they have, this is the main thing which comes under your secondary prevention. So the main interventions here are early diagnosis and adequate treatment. So they, as soon as they have seen that, okay, they have diagnosed the individual, okay, he might have cancer in the first stage of cancer, so they are trying to treat it fast, okay. So in like this, when if it is done, then it really helps in reducing the complication, or in also it helps in the promotion of the prognosis. Then the next is referral. Okay, so referral, actually, it is, what is referral? Have you heard of the word referral? Yes? Yes or no? Please answer. Referral?
No, ma'am. No,
Okay,
ma'am.
okay. Anyhow, you might not have heard. Actually, referral is a process where we transfer a client or a patient. Okay, suppose if a patient comes to GMCH. Okay, so there sometimes what happened, we might not have any specialized treatment for cancer. So from there, they are going to refer the patients to BBCI. Okay, where is this is B Barwa Institute of Cancer. So that is the meaning of the word referral. So whenever we say referral, it's like we are trying to refer the patients to another hospital. So why we are referring? Because in that hospital, maybe they might not have the necessary, they might have the doctor specific to that disease, or they might not have the equipments or the services. It cannot be done there. Okay, in order to save the life of the patient, they are going to transfer him to a better hospital. That is the meaning of the word referral. Okay. So this is actually done. So in the secondary, actually we are doing early diagnosis and adequate treatment. Suppose if that individual, he or she cannot be treated in that hospital, so immediately they are going to shift him to another hospital, okay, to with a better facilities in order to save his life. So that is the meaning of the word referral. Okay. So these are the things actually which comes under your secondary prevention: early diagnosis and adequate treatment. And if it cannot be done, they are going to give him for referral. Then the last levels of prevention we have is the tertiary prevention. Okay, so this is actually in the very last late stage of the disease. Okay, so actually mostly what it is here, it is we are trying to help the individual how to live with a disability. Okay, so because what happened in some disease, because of the complication, they might lose their limb, they might not be able to walk anymore, they might not be able to talk anymore. Okay, so those type of individuals, we are trying to limit their disability, okay, or to limit their disability, and we are trying to help them with rehabilitation. Actually, in rehabilitation also, we have various forms of rehabilitation, okay, which I will discuss later. So what do you mean by tertiary prevention? Okay, so it is all the measures which is available to limit the impairments or disabilities, minimize suffering caused by the existing departure from good health, and to promote the patient's adjustments to immediate irremediate condition. Whenever we say irremediate, that means some things which cannot be changed back. Suppose a person who lost a limb, okay, he cannot get his limb back. Okay, once it is lost, means it is totally lost. His entire life, he will be handicapped. Okay, so that is what actually it is the meaning of this. And We are trying to, in tertiary prevention, we are trying to make the people aware that even though they might be handicapped, even though they might not, so sorry. Okay, so even though they might have the disability, but still, how to live with a disability, we are trying to help them to live with a disability and in order to promote a positive aspect of health. Okay, so the main interventions done here is disability limitation and rehabilitation. Okay, so here I have actually I have given this. Okay, so what happens? First of all, we have the disease. Because of the disease, the person might have the impairment. Okay, so impairment is because suppose he might lose his leg or he might lose his limb. Okay, because or he might not be able to walk or talk anymore. Then what is the disability? That he is not able to talk anymore. Okay, and or he might not be able to walk anymore. And handicap is like he is not able to do all his activities anymore because of his disability. Okay, so whenever we say this disability, okay, we are trying to do the disability limitation, right? So here, what does it mean by impairment? So impairment means any loss or abnormality of the, because these words are actually very confusing, okay? So every time people used to confuse disability, handicap, impairments. So actually, these are three different terms which we usually indicate for the individuals who have this limitation, okay? So any loss or abnormality of the psychological, physiological, or anatomical structure or function. It doesn't just, it is not, does not necessarily, it might be only for the physical structure. It might be psychologically also, okay, it might be, he might have impairment or physiologically, okay. So the disability is any restriction or lack of ability to perform an activity in a manner considered normal for a human being. And when we say handicap, it is the disadvantage for a given individual resulting from impairments or disability. Okay, because of his disability or impairment, he's having disadvantages. Or like, so that limits or prevents the fulfillment of a role that is novel for that individual. Okay, so to be clear with this, okay, I have given some example. Okay, suppose the first year what happened because he's having an accident, so that is the disease, right? So the second is he's having an impairment. So because of the accident, he's having loss of anatomical structure, or he might be having, it might, he might hurt his spine. Okay, for that, and because of that, what happened? He's not able to perform an activity. He might not be able to walk anymore. Okay, and the handicap is, and because of that he's not able to perform his daily role. That means he's not able to socialize nicely with others. He might not be able to participate in social activities. He might not able to go for a job. So that is the meaning of the word handicap. Okay, so these are the four main words, three main words which comes under this uh, tertiary prevention. Okay, impairments. Okay, he's losing a anatomical structure, or psychologically also he might, okay, he might be losing, suppose he lost, okay, he's already having, he lost a very young, okay, this any form of relationship, okay, then all even those also it will affect the individual psychologically. Okay, then when we say disability, that means he is unable to perform that activity. Okay, then handicap, he is not able to participate well in the community, or he's not able to perform the role as a normal person should do. So another example is, for example, here the disease, suppose the person is having a dental caries. Okay, then the next one is impairment. Because of that, he have to lose his, he lost his tooth. Okay, so he doesn't have any front tooth anymore, and because of that disability is he is not able to talk because he feels shy, right? He have lost his confidence, he don't want to talk to others. And the handicap is he cannot socialize anymore. So this is actually the main things, the main difference between impairments, disability, and handicap. Okay, so these are the very important aspects which is being highlighted here in the tertiary prevention. Okay, so the next thing is your rehabilitation. Actually, rehabilitation, actually, it is a combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible level of functioning ability. Okay, so rehabilitation, actually, we have so different form, like in which we have, suppose medical rehabilitation, we are helping the individual to have, if she already lost her leg, we'll give her some artificial legs, artificial limb. So with the help of that, she'll be able to at least do her daily activities again. Then when we say social rehabilitation, we are trying to help the individual how to again have the confidence, how to socialize to others, how to speak again to others, to gain the confidence, how to trust again. Okay, so all those comes under your social rehabilitation. Okay, then another things is we have vocational rehabilitation. Vocational means it is daily related to your daily living or daily how we can really teach them how to earn money again. Okay, because so how to they might not be able to do the same work which they have done, okay, in their previous life, but they might be adjusted, they might be good in something else. So we'll try to help them, we try to train them. Okay, so with the help of that also, suppose after the accident, okay, the person might be good in drawing. Okay, so after the accident he might continue with his drawing. Okay, then he might become a very good painter, like just an example. So how we can really help the people how to earn the money back or how to earn their living again. Then we also have this psychological rehabilitation. Okay, so actually these are the types of rehabilitation. In psychological rehabilitation, we are trying to help the individual how to deal with the anxiety. Okay, how to deal with the depression. For example, an individual who have, suppose an example, an acid attack patient. Okay, so after the acid attack, she might totally lose her confidence, she don't want to communicate with others, she don't want to talk, she really have that suicidal intention. So all those things we are trying to do the rehabilitation in the psychological rehabilitation. Okay, so all these things comes under the rehabilitation. So whenever we say rehabilitation, you have to remember these four types, in which we have the medical rehabilitation, or it is also called as the restoration of the bodily function. Like I've given the example, like if an individual have lost their limbs, how we can give them artificial limbs. So with the help of that also, they'll be able to do at least perform some activities. It might not be 100% perfect, but at least it is good than having nothing. Okay, then vocational rehabilitation, restoration of the capacity to earn a livelihood. Okay, how to you can earn back their livelihood. Then social, we are trying to help them to how to again regain back their relationship with their family. Okay, a relationship with their society, community. Then psychological is restoration of the person dignity and confidence. Okay, so all this comes under the rehabilitation. So these are the things which comes under the tertiary prevention. Disability limitation, and we have, whenever we say disability limitation, we have to remember these three. Then we have the rehabilitation. Okay, so rehabilitation, it comes in many forms. Okay, medical, social, vocational, psychological. So all these we are helping the individual how to really deal with the disability, how to have a life back. Okay, clear? Everyone is clear?
Yes,
Yes.
ma'am.
Okay, I hope
Yes, ma'am.
everyone is clear. Okay, because my timing is almost over. So this diagram also you can refer it by yourself. Okay, so and the last, as the last saying goes, okay, prevention is always better than cure. Okay, so rather we try to prevent it, if rather than having any type of further complications or this effects. Okay, so with this I finish with this topic. Okay, levels of prevention. I hope everyone is clear, and if you still have any doubt, you can always ask me. Okay, so even the slides, I think I've already shared. So please go through the slides. And this level of prevention is very important. Okay, so be it in your second year, be it in your fourth year, you have to be very thorough with the levels of prevention. Clear? Okay.
Yes,
Okay, ma'am.
ma'am.
Okay. Thank you,
Yes, ma'am.
everyone.
Thank you, ma'am.
Bye.
Thank you, ma'am.
Have a nice day.
Same to you, ma'am.